Here are 3 USMLE-style questions focused on vitamin B1, thiamine, its functions, deficiency, and treatment. Question 1. A 55-year-old man with a long history of heavy alcohol consumption presents with confusion, ataxia, and ophthalmoplegia. He is given intravenous glucose to correct hypoglycemia, but his symptoms worsen. Which of the following is the most appropriate next step in management? A. Administer thiamine before glucose. B. Administer glucose, then thiamine. C. Provide thiamine supplements orally. D. Give vitamin B12 to correct the deficiency. E. Perform a lumbar puncture to rule out meningitis. Answer A. Administer thiamine before glucose. Explanation: this patient is likely suffering from Wernicke encephalopathy, a complication of thiamine B1 deficiency commonly seen in alcoholics. Administering glucose without thiamine can worsen the deficiency and precipitate the encephalopathy. Thiamine should be administered prior to glucose to prevent this risk. Wernicke encephalopathy presents with the classic triad of confusion, ataxia, and ophthalmoplegia. Question 2. A 30-year-old man with chronic alcohol use presents with fatigue, shortness of breath, and swelling in his legs. Physical exam reveals dilated cardiomyopathy with a decreased ejection fraction. Which of the following is the most likely cause of his symptoms? A. Vitamin B1 deficiency, thiamine. B. Vitamin B12 deficiency. C. Iron deficiency anemia. D. Vitamin C deficiency. E. Folate deficiency. Answer A. Vitamin B1 deficiency. Explanation: thiamine deficiency, B1, can lead to wet beriberi, which causes dilated cardiomyopathy, edema, and shortness of breath. Chronic alcohol use is a common cause of thiamine deficiency due to poor nutritional intake and impaired absorption. Thiamine is essential for energy production, and its deficiency impairs glucose metabolism, leading to ATP depletion in highly aerobic tissues like the heart. This patient's cardiomyopathy is likely due to thiamine deficiency. Question 3. A 45-year-old woman with malnutrition presents with difficulty walking, poor coordination, and confusion. A diagnosis of Wernicke-Korsakoff syndrome is suspected. Which of the following tests is most likely to confirm the diagnosis of thiamine deficiency? A. Increased RBC transketolase activity after vitamin B1 administration. B. Elevated homocysteine levels. C. Decreased serum ferritin levels. D. Increased serum methylmalonic acid levels. E. Decreased serum vitamin B12 levels. Answer: A. Increased RBC transketolase activity after vitamin B1 administration. Explanation: Wernicke-Korsakoff syndrome is caused by thiamine B1 deficiency, and the diagnosis can be confirmed by measuring RBC transketolase activity. Transketolase is an enzyme involved in the HMP shunt that requires thiamine as a cofactor. After administering thiamine, an increase in transketolase activity suggests a deficiency. Wernicke-Korsakoff syndrome presents with confusion, ataxia, and ophthalmoplegia, and it is common in alcoholics or those with malnutrition.